I have a plan that shows how we can have Medicare for all without raising taxes 1 cent on middle-class families. And it's all fully paid for by asking the top 1% and giant corporations to pay a fair share.
Also, illegal aliens, she wants to give them an amnesty so they can pay taxes to pay for it too. She didn't mention in that soundbite. We're going to get to that in a second. So this might be the moment 2020 Democrat Elizabeth Warren just lost. The big reveal on the socialist sticker shock of her government takeover of health care, scaring everyone. Top Obama officials now calling it, quote, absurd, saying Warren never got 60 votes for any legislation, so why should voters go for this? White House economic advisor Larry Kudlow weighing in. Watch.
Oh, I think it would be devastating to the economy. I mean, this idea of Medicare for all and the so-called Green New Deal and other proposals I've heard, I don't want to get into politics. On policy grounds, this would have a devastating, catastrophic effect, would probably take out as much as 15 to 20% of our entire GDP. These numbers run upwards of $100 trillion.
Okay, Hillary Vaughn is at the White House with more. Hillary.
Liz, Warren's plan will cost about $52 trillion. If you add up all the money governments, companies, employees already pay for health care, that's about $30 trillion, which means Warren is $20 trillion short. And she says she will get that from banks, businesses, and billionaires, but not the middle class. But Joe Biden is not convinced. His campaign issued this statement about her plan, saying, quote, the mathematical gymnastics in this plan are all geared towards hiding a simple truth from voters. It's impossible to pay for Medicare for all without middle-class tax increases. Moments ago, Warren was taken back by the campaign's comments.
Wow, the cost projections that we have on Medicare were authenticated by President Obama's head of Medicare.
Warren has a lot of ways she's going to get the money to pay for her plan, including $900 billion from a 0.1% tax on financial transactions and a fee on 40 of the biggest banks in America. She'll get $1.6 trillion from a 35% global corporate tax on foreign earnings for U.S. corporations. She's also putting a 6% tax on net worth above $1 billion and will change capital gains taxes annually for the top 1%. Those two changes will bring in $3 billion. Liz, Warren brags that her plan actually puts back $11 trillion into people's pockets, but she admits she's taking some of that back. She's counting on $1.4 trillion in tax revenue from that extra money. Liz?
Hillary, thank you so much. Again, to recap, we have read through the plan. Again, Elizabeth Warren wants to give amnesty to millions of undocumented immigrants, people call them illegal aliens as well, in order to get them to pay taxes to pay for her government takeover of health care. This after Warren joined other 20 Democrats and raised her hand to say yes to free health coverage for illegal aliens. Let's bring in the author of The Cure, a blueprint for solving Americans' health care crisis. He's GDP advisor, Seth Denson. Seth, your reaction to this plan?
Liz, I'll tell you, I'm wondering if there's an economist that looked at these numbers. I just, are we in a fairy tale world here? I know that Senator Warren was a professor of law specializing in bankruptcy, but perhaps maybe we don't bring those expertise to the White House and the federal budget. There is absolutely no way these numbers make sense.
Nancy Pelosi says she does not like it at all. Joe Biden blasting it. Here's the campaign statement from the Biden side. Quote, for months, Elizabeth Warren has refused to say if her health care plan would raise taxes on the middle class, and now we know why. Because it does. Senator Warren would place a new tax of nearly, wait for it, $9 trillion that will fall on American workers. Even though Seth Warren had promised no middle-class tax hikes at the last Democrat debate. Watch this.
I will not sign a bill into law that does not lower costs for middle-class families.
Your reaction, Seth?
It can't be true. The numbers don't add up. They don't work. I said it last week on your show, Liz. The numbers don't lie, but people do. This absolutely is a farce. There is no way to raise the kind of money necessary, $52 trillion. Even Bernie's plan is $20 trillion less than that, without raising taxes on the middle class.
Okay, and the other thing, too, is how can an unaccountable government take in and ingest an entire healthcare system? Doctors will flee. That's what we keep hearing. You know, the economy is going like gangbusters, great jobs report, more people than ever working, wages going up, jobless rate at a half-century low. Now Bernie Sanders thinks the government should produce pharmaceuticals. Watch this.
Look, we're not going to be, I don't have to explain to people how important prescription drugs are. They're life and death, okay? So do you think we're going to sit back and allow the pharmaceutical industry to engage in price fixing, holding the American people hostage? Of course we're not going to do that. We're going to make sure that we produce the best quality medicine in the world at the lowest possible price.
Okay, prior to that, there are questions in the campaign event, should the government produce drugs? Again, how can an unaccountable government take over health care?
It really can. I mean, even if you're talking about Bernie Sanders' plan to take over the manufacturing of drugs, it takes on average 12 years and $2 billion to bring a new drug to market. The companies that have to invest in that have done so greatly. And it's easy to vilify the pharmaceutical industry, but if you want to do that, maybe when you have a headache tonight, just take 2 Tootsie Rolls and call me in the morning. It just,
Tootsie Rolls.
You have to have drugs, right? These companies are invested heavily to bring a quality of life to the American people that the federal government just couldn't do on its own.
Seth, I want your reaction to Sally Pipes. She's a healthcare expert. She did say doctors will quit in droves if the government takes over healthcare. Watch this.
She talks about 2 million jobs being lost, half being administrators in insurance companies, and the other million would be doctors in hospitals. So we're going to have fewer doctors. Where are these people going to work? Some of these people are going to have to get jobs, and the government is going to run our total healthcare system. That's frightening. It's like, you know, having the DMV, you know, run the healthcare system.
Yeah, 2 million jobs to be lost. I mean, Elizabeth Warren agreed to that number. That's a rounding error in D.C., in the D.C. area. So your reaction to what Sally Pipes just said, Seth?
Well, she's absolutely right. I mean, listen, doctors got into medicine to treat patients, and they want to do that, but they also want to make a good living, and it costs a fortune to become a doctor in the United States today by the time you get done through school. That's not to mention all the other sides of our economic system. 1/7 of the U.S. economy that is our healthcare system. These jobs are gone. They're restructured. And the way that even Elizabeth Warren is structuring to price out this thing at 110% of Medicare, the system collapses at 110% of Medicare reimbursements. It is not sustainable.
Seth, great to see you.
Good to be with you.